Welcome to Lecture 2.3, and this lecture covers the development and aging of body systems, and the material comes from Chapter 5 in your textbook. In this lecture, we'll be covering the development of the skeletal system, muscular system, adipose system, and the nervous system. When we're studying the development of these systems, we need to take into account the importance of the constraints and that the relationship between the constraints is dynamic. Since we know that each individual grows and develops at a different rate, there are individual differences that exist in the aging of individuals. We'll start with the aging of the skeletal system. We'll watch a quick video that outlines the development of the skull bones. The child's skull has a variety of fontanelles which form sutures to seal the bones together via intermembranous ossification.
At birth, skull bones are separated by fontanelles, or soft spots, and sutures, immovable joints made of fibrous tissue. Fontanelles in the fetal skull allow for easier passage through the birth canal and rapid brain development. Up until adolescence, the fontanelles slowly ossify into sutures, providing the brain with greater protection.
Cool. So we can see here that the fontanelles will eventually ossify to form sutures, which are little joints within the skull. An ossification is the process of bone formation. The primary ossification centers are located in the mid-portions of the long bones, which are bones such as the femur, which is located in your leg. Bone formation starts at the fetal age of 2 months, or 2 months after conception. That's what fetal age means. So we can see here that the primary ossification centers are located in the long bones. The secondary ossification centers exist in the end of the bone shaft, and these contribute to postnatal bone growth. We can see that the epiphyseal plates are at the end of the bones, and they continue to lengthen the bones as they grow. While the growth at the ossification centers ceases at different times, almost all of the epiphyseal plates are closed by 18 or 19. In girls, the ossification centers begin at a younger age and are more advanced throughout childhood and close at younger ages. Tying this back to our previous lecture, we know that girls reach their peak growth in height earlier than boys, and the earlier closing of the epiphyseal plates contributes to this. A disorder that occurs due to the irritation of the tractions of the epiphysis is Osgood-Schlatter disease. The primary symptom of this disease is knee pain. This primarily occurs in adolescence and occurs because growth spurts make teens vulnerable because bones, muscles, and tendons grow quickly, but not always at the same time. Many times, overuse and physical stress also contribute to the onset of the disorder, and it is often seen more in boys than in girls. If we bring back and apply Newell's model of constraints, we can think about the interaction between constraints when playing sports in adolescence and childhood. We know that there is a growth of bone, muscle, and tendon, and there is an environment filled with peer pressure. Meanwhile, many children are playing a variety of sports that include a number of actions, such as running, twisting, jumping. Thinking about each of these constraints and the factors that influence them, How can we prevent injury in youth sports? Pause the video and take a few minutes to write down some of your thoughts you have using this model. Okay, now that you've done that, I will give you some of my own examples. In terms of task constraints, we can reduce the number of high-impact sports that our children perform and make sure that they play a variety of sports that influence various muscle groups to prevent overuse injuries. From an environmental aspect, we should discourage the culture of pushing our youth too hard in sports and placing unnecessary stress and pressure on perfection of performance. From an organismic perspective, we should be aware of the changes taking place in the body and listen to rather than push the body when the children are in pain. There are changes in the skeletal system that occur in adulthood and older adulthood as well. The loss of bone tissue begins to occur around the mid-20s, and there is an average of about 1% of loss per year. As we go into older adulthood, the composition of our bones changes as well. Children have equal parts inorganic and organic components, while older adults have more inorganic material in their bones, making them more susceptible and easily breakable. The change in composition is also accompanied by bone loss in older adults and is oftentimes caused by the changes in hormonal levels that occurs during this time period. Dietary deficiencies in calcium and other vitamins and minerals, as well as decreases in exercise, also play a role in bone loss. An effect of the aging of the skeletal system is osteoporosis, where the bones have little holes in them or are more porous. Genetics, diet, exercise, and smoking all play a role in contributing to the onset of osteoporosis. In the United States alone, more than 10 million people have the disorder, and more than 80% of the patients are women. Once again, coming back to our model of constraints, how can we work towards preventing osteoporosis? And once we have osteoporosis, what changes can we make in order to modify each of these constraints to make the living of someone who has the disorder a little bit easier? From an organismic perspective, we can change a person's dietary intake so that they increase their calcium and vitamin D, and if they smoke or drink alcohol, we can ask them to stop. We can also encourage individuals to exercise. From a task perspective, we can use assistive devices that help prevent falls or make walking easier once a person already has the disorder to ensure they do not fracture their brittle bones. From the environmental perspective, we can have handrails and fall prevention mechanisms in place to continue to help reduce the risk of injury once the person has this disorder. Let's now transition to the development of the muscle system. The muscular system primarily develops after birth, and the changes take place primarily due to hypertrophy, which is the increase in muscle cell size. There are sex differences that exist, and on average, the male muscle mass is about 54% of body weight and about 45% of the female body weight. Oftentimes, the increase in muscle mass occurs more so in the upper body compared to the lower body. We'll pause the lecture here and we'll continue with the muscle fiber types in the next part of this lecture.